Okay, read the scenario now.
Okay. Long clinical consultation. Patient Mr. Ahmed, 55 years old male. Your role, doctor in hepatology clinic. Mr. Ahmed, 55-year-old, presented with 2 weeks history of yellow discoloration of eyes and skin. Vitals, pulse 92 beats per minute. Blood pressure 110 by 70 millimeter of mercury. Respiratory rate 18 per minute. Temperature 38 degrees centigrade. Your task, take a structured history from the patient, do targeted physical examination, and manage his concern.
Okay, Dr. Rahat, thank you so much. So, are you ready?
Yes, ma'am, I'm ready.
Okay, your time starts now. Okay, before
Hello.
starting,
Okay.
uh,
Okay.
just let me give you the whole scenario that how will we perform this case. The whole long clinical consultation time is 15 minutes. So when the 2 minutes are left, I will prompt you, and this is how we will go. So your
Okay.
time starts now.
Hello. Good evening. I'm Dr. Rahat, one of the doctor in the liver clinic today. May I confirm your name and age, please?
Yes, doctor, I am Mr. Ahmed, 55 years old.
Okay. So, Mr. Ahmed, we are here to discuss about your health condition. And during our conversation, I might take some notes, but be sure that it will remain confidential between us. Is it okay with you?
Okay.
So, Mr. Ahmed, uh, can you please tell me what brings you here today?
Yes, doctor. Actually, I have been suffering from yellow discoloration of eyes for the last 2 weeks, and it's my wife who first noticed this initially, and so that's why I am here. Actually, I
Uh,
went to my GP, and he referred me to your clinic.
I'm really sorry to hear that. So, so you have this problem for last 2 weeks. Is it started suddenly or it's developed gradually?
Gradually.
Okay. Is this yellow discoloration is always there or it is coming on and off?
It is always there.
Is it the first time or even any previous episode of similar type of yellow discoloration?
Doctor, it is the first time.
Okay. So, okay. So, do you tried anything to relieve your this yellow discoloration?
No, doctor, I didn't see anything that it is just not going away.
Okay. 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 So, did you notice anything that increase your this yellow discoloration?
No.
Okay. Apart from this yellow discoloration, do you have any other problem such as tummy pain?
Yes, doctor, I have tummy pain
In which part of your tummy you have this pain?
in my upper part of the tummy on the right side.
Right side upper. Okay. Okay. The pain started for last 2 weeks or it was present before
Yes, doctor, almost for the last 2 weeks.
from the last 2 weeks. Okay. Can you please tell me the nature of the pain? Dull pain
It's
or burning? Okay.
dull pain, dull.
Dull pain. Okay. Can you please grade the pain from 0 to 10, where 0 is no pain, 10 is the most severe pain you have ever experienced?
It is almost 4 to 5.
4 to 5. Does the pain travel to any other parts of your body?
No.
Okay. Okay. Did you notice anything that increase your tummy pain, such as after ingestion of taking of food, any specific type of food, anything like that?
No, doctor, no.
Okay. Did you try anything to relieve this pain?
No, doctor, no.
Okay. Apart from this tummy pain, do you have any tummy distension?
No.
What about your back passage work?
It is normal, doctor. Initially, I just developed some loose motions for first or second day, but
Okay.
now it is normal.
Now it's normal. Okay. Did you notice any ever any blood in your motion?
No.
Okay. What about your water work?
Uh, they are a bit dark than before.
Dark. Okay. And do you have any burning pain or burning sensation during passing water work?
No, doctor, no.
Okay. Do you have high body temperature?
Yes, doctor, yes. Since last 2 weeks, there is increased body temperature.
Increased body temperature. Can you tell me what is the highest recorded temperature? Did you measure it?
Uh, no, doctor. Actually, the doctor, my GP measured it, but he said that yes, you have increased body temperature. He didn't tell me the readings.
Okay. Does the body temperature comes in a particular time of the day, or it's remain throughout the day?
Yes, doctor. Almost throughout the day. There is no specific timing.
Okay. Okay. All right. Okay. Do you notice any lumps and bumps any part of your body?
No.
Did anybody tell that you are getting paler day by day?
No.
Any feeling of dizziness when standing from sitting position?
No.
Any racing pacing of your heart?
No.
Okay. All right. So, do you have any long-term condition that I should be aware of?
No, doctor. Nothing like that.
What about your weight? Do you recently lose or gain any weight?
No, doctor. It is same as before.
Okay. Do you have any joint pain?
No.
Any back pain?
No.
Okay. Okay. All right. So, uh, did you take any medication for any condition, any long-term medication taking?
Not for long-term condition, but yes, doctor, I took paracetamol and Augmentin because of some chest infection. Almost, you can say 20 days back, almost 1 month back for the last 10 days.
For the last 10 days. So, you take this augmented. For how long you take this medication?
For 10 days.
For 10 days. And you, after your yellow discoloration develop after this taking of the medication,
Uh,
after completing the course
Actually,
of the
doctor,
medication.
almost 1 month back, I suffered from chest infection. I went to
Yes.
the GP. He gave me Augmentin. That is, I have to
Okay.
take 3 times a day and paracetamol as well because at that time also I suffered from high grade increased body temperature, and I was taking 2 paracetamol 3 times a day for the 10 days. And after 10
Okay.
days, this thing has developed. Almost 1 week, you can say this thing has developed.
Okay. 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 Apart from this medication, are you taking any other medication?
No.
Okay. Are you allergic to any medication?
No.
Okay. Did you take any herbal medication?
No.
Okay. And now I'm going to ask you some personal question. Do you smoke?
No.
Do you drink alcohol?
No.
Okay. 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 So, do you? I'm going to ask you more personal question. Do you take any medication for recreational purpose?
Yes, doctor.
Okay. For uh, how long you are taking this?
For the last 10 years.
For the last 10 years. Did you take through your blood channels?
Yes.
Okay. Okay. So, do you have any long-term relationship?
Yes, doctor. I am married.
Okay. Any history of any casual contact?
Yes, doctor, there was a contact 5 years back, but I have abstained it now.
Okay. Okay. Did you practice safe sex then?
No.
Do you have any history of blood transfusion?
No.
Okay. So, okay. So, what do you do for living?
Doctor, I am a driver.
Driver. Okay. How much the symptoms affected you?
Yes, doctor, for the last 2 weeks, because of these symptoms, especially because of the increased body temperature, I'm not able to resume my job, and it is affecting me.
Okay, I'm really sorry to hear that. So, for that reason, if you wish, I can involve the social service. They might help you until you are recovering from these episodes. Is that all right?
Okay, thank you.
Okay. So, did you recently travel to anywhere?
Yes, doctor, I traveled 6 weeks back.
6 weeks. Where you go there?
I went to the northern areas of Pakistan.
Northern area. Where did you stay there? Any? Where did you stay there?
Yes, I stayed in a hotel.
Hotel. Okay. Did you take any food from roadside?
Yes.
Okay. All right. Okay. All right. Did you notice any uh, thrown up? Any history of thrown up?
No, doctor, not throwing up, but there is some feeling of sickness.
Feeling of sickness. Okay. 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 Did you notice any shakiness in any part of your body?
No,
Okay. Did you notice that your sleep pattern is changed? That more
no,
sleepy at the daytime?
no,
Okay. What about your okay. Okay. Any did you notice any coming any blood through any other orifice?
no.
Did you ever done any tattooing?
Yes, doctor.
Okay, right. So now I want to examine you.
Okay.
Okay, first of all,
You
I want
just
to
tell
take
me, okay, Dr.
a
Raj, you
general
just will tell
examination.
me the steps
Okay.
and then I will tell you the positive findings at the end of your examination. Okay.
Okay. First of all, I need full exposure, and I want a general examination of the patient. General looking of the patient. Patient is icteric or not. Then I want to check the patient hand, the finger, any clubbing presence or not. Then I want to check the any stigmata of chronic liver disease, any leukonychia, any flapping tremor presence or not, any tattoo mark or any needle sharing mark presence or not. Then I want to check the patient vitals, blood pressure. Also check the eye for any anemia, any jaundice. Then check the oral cavity for any under surface of the tongue for jaundice. Also, I want to check in the neck for lymph node, and then I want to check the any features of gynecomastia, and also I want to check the chest for any spider nevi. Then come to the abdomen for any abdominal distension, any ascites presence or not, then any organomegaly, any liver hepatomegaly presence or not, any tender liver, and also the patient general skin texture, any darkening, any high color presence or not, then any splenomegaly presence or not, and also I would like to check the patient private area, testicular atrophy, and also the patient urine for deep stick and in hematuria, and also patient have any peripheral edema presence or not. Hello.
Okay. Yes, yes, yes. Okay, doctor. Apart in all these findings, there is a patient is ecteric. He has deep jaundice. There is tenderness in the right hypochondrium and tender hepatomegaly, two finger breadth below the right costal margin. Apart
Okay.
from this, no other finding. Apart from some scratch marks.
Scratch mark. Okay. Okay. Do you have any itching?
Yes, doctor. There is some itching.
Okay. Do you have any sleep disturbance for this?
No.
Okay. So for that reason, I will. Okay. I am coming to that in the later part of our history. So okay. All right. So may I know what's your concern?
Yes, doctor. I am quite concerned that what's going on with me.
Okay. I appreciate your concern. As far as you have given history to me and I have examined you, uh, I think you have. There are a couple of possibilities. One of the possibilities is that you might have a condition called viral hepatitis. Don't bother about the medical term. Actually, there is soreness in the liver, uh, mostly due to some virus, and that may be come from the tattooing you have done or in the needle sharing you have history. Are you able to understand my point?
Yes, doctor. Yes.
There are some other possibilities as you have taken
Two
the
minutes are left.
okay, as you have taken the medication called augmentin for your lung condition, and this medication sometimes may cause soreness in the channel that connect our liver to the gut. So it is also a possibilities, and as you have also have a history of trouble recently, there might be some bug infection also might cause. So before for that reason, I would need to do some run some blood test, also your urine test, also scan of your tummy, and after all the report available, I will be in a better position to say what is actually going on. Is it all right with you?
Okay.
Okay, do
So,
you have
doctor,
any
is
other
it a
concern?
yeah, is it a curable condition?
I appreciate your concern. Uh, as far I'm telling, if it is a viral hepatitis, then we will give you medication to subside the condition and also advise you to take some rest. But I need to find out the cause. Hopefully, after finding the cause, I will be have an answer for it. Is that all right?
Okay.
Do you have any other concern?
Yes, will you admit me today?
Yes. As you have, okay. Currently, I don't think you need admission. We will do some test and hopefully after the sample and we will have another meeting. We will give you a follow up. Is that all right?
Okay.
Do you have any other concern?
Yes, doctor, I want to know that is it because of the IV drug which I use? Is it because of that?
There is a possibilities due to this sharing of sharing of needles. There is a possibility
Time is
some
over.
virus. Okay.
Okay. So, uh, now you are coming towards the examiner for the Viva part. So he will ask from you that just tell me the positive findings in your history regarding this patient.
Okay, on history of this patient has jaundice for last 2 weeks, and he has a history of taking amoxiclav for his for a respiratory infection. Also, patient taking paracetamol for that period. Also, patient has a history of needle sharing, also tattooing. Also history patient has history of traveling to a place. So uh, yes, that's at the point in my history.
Okay, and what are your positive findings in examination?
Okay, in examination patient has icteric and patient has tender hepatomegaly to swinger breath, and there is some scratch mark presence. And uh, yes, these are my positive finding in examination.
Hmm. Any other positive finding in abdomen?
Abdomen patient has tender hepatomegaly
Hmm.
and patient has scratch mark.
Hmm.
And apart from this, uh,
Okay, so what are your differential diagnosis in this case?
so my top of my differential would be it may be a viral hepatitis.
Hmm.
My top of my differential. Then it might be a case of liver abscess. And
Hmm.
then number three would be drug related hepatitis.
Hmm.
And number four will be though it's a remote possibility. It may be a case of uh, leptospirosis.
Okay. And how will you investigate this patient?
Investigation. First of all, I would like to do complete blood count with inflammatory marker, and then I would like to do liver function test, serum bilirubin, and HGPT, alkaline phosphatase, and then I would like to do prothrombin time and INR,
Hmm.
and I would like to do uh, uh, then I would like to do the viral marker HbSAg and THCB, then
Hmm.
ultrasonography of whole abdomen, including hepatobiliary system, then
Hmm.
serum electrolyte, uh,
Hmm.
serum creatinine, serum electrolyte, and yes, this will be my investigation.
And how will you treat this patient?
Treatment, general and specific. General management, patient education, explanation of the condition, and
Hmm.
patient involving forming a multidisciplinary team,
Hmm.
and uh, and patient uh, uh, according to the cause. I will manage. I will give him some bed rest, and if the patient has some nausea, I will also give him some medication for relieve it. And after finding the cause, I will treat accordingly.
Okay, and keeping in mind that this is a case of viral hepatitis, which is your top differential, how will you treat that case?
Top of my differential is viral hepatitis. I will bed rest. I will also advise him to take plenty of water and
Mm,
supportive management. And according to the cause, if it is due to uh, hepatitis A, acute acute hepatitis, our most management is symptomatic.
mm, okay. Time is almost over. 30 seconds are left.
Mhm.
Okay, Dr. Rahat, overall, it is a very good performance. And you have a good approach to the case. You started all the things in a sequence manner, the history, that is the greeting, introduction, and checking the identity, and telling the patient what is your agenda today, and telling him everything will be kept confidential, and all of the uh, starting point of the history. In basis, since we have only 15 minutes of this long clinical consultation, although this is good thing that previously it was only 10 minutes and now it is 15 minutes. And regarding the time management, yes, you almost completed the history in 9 minutes, but still, whenever it is a case of, I mean, any presenting complaint, most of the time, if you want to ask each and every question, sometimes it becomes quite difficult to ask each and everything. For example, certain questions you have missed in the history in this case as well. However, you have kept the sequence in a proper sequence manner, and the examination as well. And your differential diagnosis is very good because you have kept each and everything in the mind. However, a few things which I would advise you, that, for example, you are starting the Viva. Now you are narrating your history. Start by telling the name of the patient and the age of the
Okay.
patient. Even when you will come inside the room for your case, you will check the identity of the patient yourself. That you will ask, am I speaking to Mr. Ahmed, 55 years old? Because sometimes the patient are not ready that what you want to ask, who are you or something like that. You ask the patient name and age yourself. And likewise, when
Okay.
you were telling the history to the examiner, at that point you also narrate the history in the similar way, that Mr. Ahmed, 55 years old, presented with yellow dysentery. Instead of saying something like icterus or jaundice or something like that, always try to tell each and everything in the sequence manner. And this would only be possible if you keep important positive points in the history on the paper. Okay. And regarding the positive findings in the history, sorry, in the examination, yes, tell the positive findings and important negative findings as well. Okay.
Okay.
And let's discuss this case again. For example, and something like this, that in case of jaundice, usually in the initial stages of jaundice, somebody else notices the change of color of eyes of the patient, not the patient himself, unless and until he develops the worsening of jaundice or there is some deep discoloration of skin as well. And one thing, for example, here I would advise all of you that whenever you are outside in the exam hall and you get the case of long clinical consultation, so here you will be given a paper which will accompany you inside, because outside the paper on which the scenario is written, you have only 3 to 4 minutes that you will read. Although it is 5 minutes, but still you have to change and move from one station to another. You have to drink water in between. So consider it 3 minutes. So on that paper, you will, first of all, you will read the scenario carefully, and the paper which has the examiner has hand over to you, you write the name of the patient and age of the patient on the paper, and consider that whether you have to take history from the patient or from the relative of the patient. And in case it is the relative, you will write the name of the relative and his relation with the patient. Then you will write the presenting complaint. And in case if any clues are given in the form of vitals or in the form of lab parameters, for example, here today in the vitals, only one clue, that this patient has temperature, he is febrile. Only this clue, that fever and jaundice, you have to see inside. So now think about this presenting complaint and formulate a plan of action when you are outside. And meanwhile, what you will do, you will also make the differential diagnosis. Okay. And this making up of your mind will help you that how you will approach this presenting complaint. So here the presenting complaint is jaundice. So there are certain types of jaundice. It is not necessary that you will get a case of viral hepatitis or you will always get a case of chronic liver disease or hepatocellular carcinoma. It can be a wide variety of things which you can get inside the exam. Are you able to see my screen?
Yes, ma'am.
Okay, so this is the thing which I made during my preparation, that how we can approach a case of jaundice. Especially, I mean, this class is not only meant for the PACES candidates, but it will be helpful to all those who are appearing in FCPS, whether Bangladesh, whether Pakistan, or in case of MD exam. I mean, the local postgraduate level exam or any clinical medicine exam that you are appearing in. This will help you that how you can approach a case of jaundice, especially in case of FCPS exam. What they want, they have a long history, they have full 30 minutes of long case. So in those cases, the examiner wants that you ask each and everything from the patient. Even in cases, the examiners also want this, that you take the history in a quite extensive manner, no need to leave any important thing. For example, I have zoomed this picture. I think it will be visible to you. Is it, Dr. Rahat?
Yes, visible.
Okay, so there are three causes of jaundice, or three types of jaundice: prehepatic, hepatic, and post-hepatic. So you have to at least rule out or keep these things in mind, that any case of jaundice can come in the exam. For example, in the prehepatic causes, there are hemolytic anemia, secondary to thalassemia, sickle cell anemia, hereditary spherocytosis, G6PD deficiency, paroxysmal nocturnal hemoglobinuria, malaria, and microangiopathic hemolytic anemia secondary to any autoimmune disease. Then congestive cardiac failure, prosthetic heart valves, hemolysis, multiple blood transfusion, and congenital conditions, that is Gilbert syndrome, Crigler-Najjar syndrome. And it is a very good thing that you started the history in a very good manner. Like, I like the way that you asked that is it for the first time or it occurred before as well. This question is very, very important, even if you ask this in the start of your OD para, because this will help you to rule out multiple things, not only in case of jaundice, but in other things or other presenting complaint as well. For example, here you ask that whether it is recurrent jaundice. Then this recurrent jaundice can tell us multiple things. Like, for example, here the patient can have congenital conditions in which the patient can suffer from recurrent jaundice because of Gilbert syndrome. So whenever there is increase temperature outside in summer season, or because of dehydration, or because of any ongoing illness in the patient, these patients can present with recurrent jaundice. Similarly, the patients of choledocholitis, they can present with recurrent jaundice. And this question, that is this symptom right now or it occurred before as well, this will help you in multiple other conditions. For example, a patient has come with paraparesis, and this question will help you to rule out multiple sclerosis. And even you can apply this question to multiple other presenting complaints as well. Now coming towards the other causes. For example, yes, Dr. Rahat, you asked about the blood transfusion, and these questions are basically asked in a sequence wise. Whenever you are taking the history in a sequence, these questions will come, their turn will come. Or for example, in case whenever you are appearing in FCPS or MD exam, in that case, you have to rule out all the differential diagnosis. So in that part, you can ask these questions in your history of presenting illness. Then come towards the hepatic causes. Hepatic causes, the most common cause is hepatitis. It can be alcoholic hepatitis, it can be viral hepatitis. And in viral hepatitis, it can be acute, it can be chronic, or acute on chronic. And even hepatitis A, B, C, D, E. These all can cause jaundice. And cytomegalovirus, Epstein-Barr virus, HIV, AIDS, cholangiopathy, although they are rare causes, but still they are the causes theoretically. And even you can be able to see the patients of this condition. And this alcoholic hepatitis can also present with fever. Then cirrhosis secondary to chronic hepatitis, non-alcoholic fatty liver disease, hemochromatosis, Wilson disease, alpha-1 antitrypsin deficiency, autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis, hepatocellular carcinoma, Budd-Chiari syndrome, and yes, the differential you gave, leptospirosis, drug-induced liver injury, for example, secondary to acetaminophen, or secondary to anti-tuberculous therapy like INH, environmental toxins, for example, anyone who is working in a dry clean agents factory, or where there is exposure of vinyl chloride, or there is exposure to mushrooms, they can also develop this kind of jaundice. And the post-hepatic causes, all of us know the quite common cause: obstructive jaundice, cholestatic jaundice, which can be secondary to malignancy, either cholangiocarcinoma, pancreatic carcinoma, gallbladder cancer, ampullary carcinoma, or gallstones, that is choledocholitis, hepatobiliary causes, cholangitis, stricture of bile duct, chronic pancreatitis, and certain procedures can result in jaundice, for example, post ERCP, post biliary surgery. So these questions you should also ask whenever it is a case of jaundice. For example, you asked about the dark color discoloration of urine or waterworks. Here you can ask the question of obstructive jaundice, that is there any white or clay colored stools. Stool is a jargon. You can use the word loose motions. Okay, Dr. Rahat. Uh, I'm not sure that you are here or not, but I want that somebody unmute their mic so that at any time
Yes,
you
ma'am. My
people are
mic
not.
was mute.
Okay, okay, okay. Okay, so this question you can also ask when you are asking about the darkening of urine. You can ask about the clay, white, chalky colored stools. And yes, you asked about the weight change, but you didn't ask about the appetite, because these questions go side by side. If there is, for example, weight change in the form of weight loss, is there any decreased appetite? Likewise, a bit loss of sequence was there in your history.
Okay.
Okay, somebody has written that they can't hear me. My voice is
Yes,
clear, Dr.
audible.
Rahat, right?
Yes, audible,
Okay,
ma'am.
okay. And so at that point, when you were asking about, I think, vomiting, you asked that in quite after, I mean, asking all the questions. So we will come after this slide. I will tell you how you take the sequence, and it will not cost much time. Okay. And regarding the ERCP, for example, when you were asking about any long-term conditions, or you were asking about the past history, so that you can ask about the ERCP or any procedure done. Okay. So
Okay.
just another question, just to play safe, so that you don't left anything for the examiner, that he will pick out mistakes, that yes, you have certain questions left, or for example, you were in a hurry, or for example, all of us are in a hurry whenever we don't know that, or we are not sure that what is the diagnosis, because all of us jump toward the diagnosis, although in the initial few minutes the diagnosis was in your hand. For example, you have the history of yellow discoloration of eyes, you have the history of increased body temperature, itching you asked after examination. It's okay, because we are humans, we make mistakes. So it is good that at least you asked after having the examination, that yes, itching is also a part of this trial. And regarding all other things, huh? So whenever coming towards the main task, for example, history, now you are inside, the bell has rung, you are going inside to perform this scenario. First of all, you will greet the examiner, then you will greet the patient or the surrogate. Then you will introduce yourself, then you will check the identity of the patient yourself, his name as well as his age. Then you will set the agenda, that I have been asked to take your medical history, I will do your examination, and in the end, I will answer all of your concerns. So all these three things which are your task, you will tell to the patient or the surrogate. Then you will say, is that okay with you? He will say, yes, it's okay. And then you will ask, meanwhile, I will write few notes, but let me tell you that they will be kept confidential. Okay, okay. So this thing basically comes in the welfare, that you have maintained the welfare of the patient, that you have taken his history and put it confidential, and during your examination, you have not caused any pain to the patient. So these, in this way, you will be marked in the welfare. And then you ask the presenting complaint. Yes, it is very good that you ask that, please tell me in your own words that what brought you to the clinic today. Because a few candidates have the habit that they just read the presenting complaint outside, and then they come inside and start it like this. But always say that, tell me in your own words, because sometimes what they do, they wrote something outside and there is a bit different inside. So always check the first question, open-ended question yourself. Okay. And yes, somebody is asking that, can we write or take notes during taking history? Yes, doctor, you will take the notes. Otherwise, it is not possible humanly that we can narrate each and every question in the history to the examiner. So you will write the things on the paper, all the positive things. Okay. So in case you know the sequence, in that way you will write the positive things. And one thing more, for example, even it is, just make it a habit, in case if you feel it easy, that when you are outside, you wrote the name of the patient, the age of the patient, the presenting complaint, and after that just make a rough um, I mean the structure that how you will go inside. Okay, first you can write the presenting complaint, that is the yellow discoloration. You can write the OD para, onset, duration, progression, aggravating factors, relieving factors, and associations. And since here, even when you are outside, you know that it might be a case of gastrointestinal system or hepatology. Okay, so you should know that I will ask after all of the OD para, I will ask all the questions of GIT. I will finish those questions, then I will move towards general or constitutional symptoms that Dr. Rahat asked in a quite good manner, but still there were few questions left. For example, fatigue, increased feeling of tiredness, lethargy, they can be there. Okay, so it can not only point that this patient is suffering from acute viral hepatitis, they will also point that this patient can be a case of like autoimmune hepatitis. And likewise, Dr. Rahat, here you left the part family history.
Yes, ma'am.
So these things, examiner note these things, I mean the sequence quite well. So the sequence should be complete and it will be possible only when you are writing, okay, after general constitutional symptoms, you can just write DD. For example, sometimes it might be in case of cases you have less time, you will not be able to rule out all the possible differential diagnosis. But after that, just write the PAM, hug, pause, or any mnemonic that you have made. That is the past history, allergy, medication, family history, and then comes your social history. Even for example, here it is a female patient, there would be multiple questions which you need to ask in that case. For example, this jaundice might be in a lady who is taking oral contraceptive pills. It might be a case of hepatic adenoma, or for example, it might be a case that she is a pregnant female and here the jaundice is because of her pregnancy. So see, like these things will add up if it is a female. So here you will write down family history or just the F when you are outside, and then the social history. And ask each and every question of social history because this part is very much liked by the basis examiners. They will not, I mean, they will not spare you if you leave this point, social history. Okay, so social history is very, very important. Okay, after that, for example, yes, you asked about the presenting complaint. Outside, I mean, inside, you asked the open-ended question, then you completed the OD para of the jaundice. And yes, it is a very good thing that you asked that is it for the first time or it occurred before as well? Because recurrent episode of jaundice means that now you are narrowing down your differential diagnosis in the form of Gilbert syndrome, Crigler-Najjar syndrome, which are the congenital conditions which are because of the disorder of bile transport, and about the gallstones, that is choledochoritis or even cholangitis. Cholangitis can also present like recurrent episodes of jaundice, although it is not a very important case in case of medicine, but it has come in. I mean, it can come. You should know that it is a cause of recurrent jaundice. And after that, you will ask about the pain in right hypochondrium or pain in the right upper part of the tummy, and what this question will help you. It will not only tell you that okay, now I am feeling good, that it is a case of viral hepatitis, which is a very common case in the exam. It will not only help you in this manner, it will also help you to differentiate between the painless causes of jaundice and painful causes of jaundice. Because painless causes of jaundice, again, then you can narrow down your differentials. Like if it is a painless jaundice, there is no such pain, there is no fever, it can be because of malignancy in the form of pancreatic malignancy, CA head of pancreas, or bile duct malignancy, cholangiocarcinoma, or even in case of autoimmune causes of hepatitis, they can also cause painless jaundice apart from other symptoms. And this drug induced liver injury, it can also lead to painless jaundice most of the time. And the painful causes of jaundice, yes, you are right, acute viral hepatitis, cholangitis, even Budd-Chiari syndrome, if it is a chronic, I mean not a chronic condition, but Chiari syndrome can present like this manner. And even acute liver failure and hepatocellular carcinoma, but hepatocellular carcinoma will have a long back history. In past history, there will be a case of cirrhosis or something like that. And after that, yes, you ask about the fever, that is increased body temperature. Again, if in case if it is febrile, then causes will be viral hepatitis, and even alcoholic hepatitis and cholangitis. After that, yes, you asked about the color of urine. Here, you should ask about the color of stools as well, because dark colored urine and pale stools are classical symptoms of obstructive jaundice because of excessive conjugate conjugated bile in the urine, and there is lack of excretion of conjugated bile in the intestine, leading to this lack of stool pigment, that is the pale colored stools. So in this way, in case if you are asked this question and it is a case of obstructive jaundice, so you have the diagnosis quite early in your hand, in early part of your history. And one thing more, that yes, dark colored urine can be a symptom of hemolytic jaundice or prehepatic jaundice. For example, in case if it is a case of, for example, hemoglobin urea, because of that condition, they can patient can complain of dark colored uh, waterworks. And pruritus, yes, you will ask this thing because it will tell you not only bile hepatitis, it will tell you that it can be a cholestatic process going on. That is bile duct obstruction, drug-induced liver injury, or for example, even autoimmune causes of jaundice. And here, after asking all of these questions, now instead of jumping towards the general questions, first complete the questions of your system that you are running with, GIT and hepatology. Here you will ask that is there any feeling of sickness, that is nausea, any feeling of throwing up, that is vomiting, any heartburn, any acidic sensation or metallic taste in your mouth, difficulty in swallowing, tummy pain. Okay, you have already asked. Here you will ask about the loose motions or constipation, because okay, Dr. Rahat, my voice is audible.
Yes, audible.
Okay, so when you were asking about the loose motions, here not only loose motions, yes, you asked that is there any blood in the loose motions, because this question can tell you that it can be a case of inflammatory bowel disease, that is ulcerative colitis, and the underlying presentation is because of primary sclerosing cholangitis. Okay, and
Yes,
yes, here you will ask about the tummy distension. Even here you will ask about any heaviness in the right upper part of your tummy or in the left upper part of your tummy. So this is a question where you can ask about the visceromegaly even before examination. And here ask about all the complications. For example, when you were asking about increased sleep pattern or disturbance in the sleep pattern, that you sleep more in the daytime or less in the night time, or any feeling of loss of sensation, loss of senses, that is unconsciousness, or for example any blood in your vomiting, or any blood in your what loose motions, that is even this melina is not the fresh blood, it is actually the black tarry foul smelling loose motions. And these are loose motions, these are not the formed stools. Melina is always loose motion, and they are foul smelling, they are black tarry. And even here you can ask about any easy bruisability. For example, in case this is the case of chronic liver disease, can lead to any cause. Either it is viral hepatitis, alcoholic hepatitis, because these questions you will ask in the further part of your history, in the social history. I mean, the risk factors. Yes, you ask about tattooing, you ask about illicit drugs, but okay, coming to before moving to that part, let me complete here first. That you have completed the GIT questions, then you will move towards the general constitutional symptoms. For example, fatigue, lethargy, because constitutional symptoms are first of all fever, you have asked. And I think sometimes what happens to all of us, that whenever we get one positive finding in the history, for example, like fever, here you got, and then from fever you got distracted and you move toward the constitutional symptoms. That is the increased pigmentation, skin rash, lumps and bumps, weight changes. But if you follow the sequence, then you will ask each and every question. For example, here you will ask about the fatigue, lethargy, increased feeling of tiredness, skin rash, skin pigmentation, darkening of skin, lumps and bumps, weight changes, weight loss. Whenever you are asking about weight loss, here you will ask about the appetite. Is there any increase in appetite? Joint pain. Joint pain will tell you multiple things. For example, it might be a case of hemochromatosis. It might be a case of autoimmune causes. And here, patient has multiple other things apart from autoimmune hepatitis, other joint pain condition like these as well, and weather preference as well. And for FCPS candidates, they need to rule out all the prehepatic, hepatic, and post-hepatic causes of jaundice here after asking about the general constitutional symptoms. I mean, one, two questions of all of these things, if they have not asked or they will not find time because they will have to do the examination, then they will come back to the patient again. But for PCS candidates, they will get the chance to ask these questions in the later part of their history, in the social history and in the family history. because the basis examiners will not mind this, that you are asking each and every question of jaundice or each and every cause of jaundice, but they will mind in case if you spend too much time on the history, because it will only be possible if you spend a good 15 minutes on the history, then you will be able to rule out all the causes of jaundice. Otherwise it will not be possible, and you should start your examination at 8 minutes or 9 minutes of your history, like you do, because 9 minutes is more than enough, because the examination itself will take a good 6 minutes. In case if you are doing each and everything, it will take 6 minutes. So the best thing is that you do 8 minutes history. I mean, the ideal thing is basically if you do the 6 or 7 minutes history, 6 or 7 minutes examination, and then you will leave 2 minutes for the concerns, because concern itself has 4 marks. The history has 4 marks in the form of clinical communication. Examination has 8 marks. That is physical examination. You will given 4 marks if you identify all the physical signs. Identifying physical signs itself has 4 marks, and then concern has 4 marks. So this will make total 16 marks. So still you have I mean 8 marks left. Those are for maintaining patient welfare, clinical judgment. Whenever you are going to start the viva, then you will be um, assessed in the clinical judgment. And maintaining patient welfare will be assessed during your examination as well as during your history, that you are keeping each and everything confidential or you are not judging the patient. For example, in case if he is alcoholic or he's a smoker or he has positive sexual history, or in case he has history of illicit drug abuse, or and during examination you will be assessed that you have caused harm to the patient in the form of causing him pain because he has pain in the right hypochondrium. So after this point, for example, a history of presenting illness you have completed, then you will move towards the past history. Any condition that you are diagnosed in the past, any disease in the past, like for example, diabetes or increased blood sugar level, because in case if it is there, it will guide you that it can be a case of non-alcoholic fatty liver disease, or for example, any autoimmune disease that the patient is suffering from. Even here, you will ask about previous hospitalization. It might give you a clue that it is a case of chronic liver disease. Or for example, it can be you will even ask any surgery in the past or any procedure done in the past, because any procedure done in the past is basically for example like for ERCP or for any kind of bile surgery, and any surgery in the past, for example in case there is a recent surgery in the past, like for example 15 days or like for example within 1 month, it can be a case that if patient has some liver injury secondary to anesthetic volatile agents. Okay, and for example here you can even ask, for example, in case, yes, here you can ask about any recent blood transfusion in case if you have not asked before. And after that, yes, you ask about the allergies, you will ask about the medications, like over the counter medication, any Hakim medication, herbal preparation. And even if it is a female, you will ask about the oral contraceptive pills, that is any birth control pill that she is taking. And here you will ask about the detailed medication history, that the patient is taking paracetamol and patient is taking augmentin. Yes, you asked each and everything about that. Here you will ask about family history, especially for example any kind of autoimmune disease or any disease running in the patient family or any cancer in the family. Okay, so you will ask this question quite specifically. Each and every step has its own marks. Then before jumping towards the social history, you will give a warning shot to the patient. Dr. Rahat, are you able to listen to me?
Yes, ma'am.
Okay. So, warning shot is very important in case of asking all the personal questions from the patient, because you have to ask about sexual history here. You will ask about the illicit drugs and multiple other questions, even alcohol, smoking. These things are not quite liked by the patient because uh, when you will say, now I am going to ask certain personal questions from you, they will be kept confidential, and we ask these questions from all of our patients. Okay, then you will ask about the smoking. Do you smoke? Have you ever smoked? Do you drink alcohol? Have you ever drink alcohol? Because alcohol is very, very important over here. And in case, for example, if he use alcohol, you will ask about how many pints per week. And here you should know the range of safe alcohol intake in case of this condition, because in case it might be a case that he is alcoholic hepatitis, and here you will refrain him from using alcohol, because here it is directly linked to the condition. However, in any other case, for example, it is a any other case like neurology, chronic conditions, or any autoimmune disease you get, and the patient is alcoholic. So in UK, they recommend that if the patient is using the safe alcohol dose, no need to refrain him, because it is their culture. Okay, but smoking, in case if it is there, you will advise that if smoking is injurious to health, we will advise you to refrain from smoking, and we will refer you to the smoking cessation clinic. Then you ask about the job. He is a driver. Impact on daily activities. It is a very good thing that you keep on showing certain kind of empathy. That whenever the patient tell you about the presenting complaint, you show some empathy. When you asked about impact on daily activities, you again show some empathy. And while showing empathy in case of job, here you will refer him to the occupational health physicians, not the social services, because you are talking about the job matter. Okay. And regarding the illicit drugs, okay, this part is a bit lacking. For example, you will ask which drug he is using, the name of the drug. In case he will know, he will say, "No, doctor, I don't know," or for example, he just don't want to tell. Then it's okay. But you will ask here, na? You said that okay, is it in the blood channel? Yes, he said yes, it is in the blood channel. You should ask the name. Do you know the name of the medicine? Medicine, I mean, it can be cocaine. Cocaine is quite harmful to the liver. Okay, and for example, here you just assume, I think yourself, that the patient is using, patient is doing this needle sharing, because I think you didn't ask this question from me, that are you sharing the needles with your partner or friends or something. Okay, so here you will ask that do you use any sterile needle yourself, or you practice this needle sharing as well. And yes, you asked about the tattooing before, so it's okay. Otherwise, you can ask this thing over here. And here even you will ask about any recent ear or nose piercing. It might be a case that yes, he has done this thing a couple of weeks ago. So again, it will give you a clue that he has exposure to this viral hepatitis. And regarding the sexual history, yes, you asked about it. Again, it is giving you a clue that it might be a case of viral hepatitis, not only AE, it can be any other viral, for example, B and C as well. And regarding the travel history, it should be explored a bit more. For example, yes, you asked about which area he traveled to, almost how much time he lived over there, what sort of water he consumed, because it might be a case that he just drank the local tap water, not the mineral water or bottled water. No? So again, it will give you a clue that he has exposure to orofecal intake regarding the hepatitis A and E. And regarding the street food, yes, you asked about that. And even here, you can ask about that what were his activities over there. Because it might be a case that he has gone to some streams or some lakes, and here he can get exposure to the uh, this
Leptospira.
yeah, leptospirosis, the rats or these animals urine, he can get exposed to that as well. And here further other questions as well. For example, here did he took malarial prophylaxis before traveling, although this area is not that prevalent for malaria, but still you should ask this question, because malaria is a cause of prehepatic jaundice. And even you will ask any vaccinations before his travel. For example, some people can have vaccinations for like these questions. Okay. And regarding the examination, yes, you did the examination, but always give it a good 5 to 6 minutes, because this thing is in your hands, and the examiner know quite well that this candidate is well practiced or not. And regarding the examination, yes, you will have a general look of the patient, whether he has deep jaundice or he is cacaceous. And after that, starting from the nails, you will look for clubbing, leukonuchia, koilonychia. Even you will look for Terry's nails. That is the this proximal one third, or what we will say, the area where the nails are growing. This area is dark. Only this one third is dark in case of Terry's nails. It is not the similar half and half nails of chronic kidney disease. It is a bit different than those patients in case of chronic liver disease. These patients have only this one third area dark, and rest of the nail is okay. And these are basically the Terry's nails. Then in the palms, you will look for palmar erythema, you will look for Dupuytren's contracture, even you will look for finger prick marks, because it might be a case of non-alcoholic fatty liver disease. And here you will know that, okay, I forgot to ask any specific history of diabetes. Here you can see that yes, this patient may be diabetic because of this finger prick marks. And in the hands and in the arms, you will not only look for IV drug marks and tattoos that you told, you will even look for any white patches, vitiligo patches. It will give you a clue that it might be a case of autoimmune hepatitis. And in the eyes, you will not only look for jaundice and conjunctival pallor, here you will also look for xanthil asthmas. Although it is a male patient, but this primary biliary cirrhosis, it is common in female patients. And this thing will again give you a clue that since I have this xanthil asthma, so I will keep this differential of primary biliary cirrhosis in my GDs. And regarding the face, you will also look for temporal wasting, even the receded hairline, because this hairline is receded in case of chronic liver disease, and parotid swelling as well, which will give you a clue that it is a case of alcoholic liver disease. And yes, in the next, you will look for cervical lymphadenopathy, spider nevi, gynecomastia, tattoo marks. And when you were asked about the tattoo marks, you should ask that where he has made this tattooing. He told you that he has made this tattooing a couple of years ago, 10, 15 years. So you will ask where, so that you can look at that during your examination. And even you will look for a loss of male pattern hair loss, which can be there in case of chronic liver disease. And in abdomen, first in inspection, you will look for any abdominal distension or any bulging in the right or left hypochondrium, and any drain marks. For example, in case it is a case of cirrhosis underlying, so drain marks for ascitic fluid drainage. And during your superficial palpation, while looking towards the face of the patient, here you will assess that whether this patient has tenderness in the right hypochondrium. And be gentle when you are examining for hepatomegaly, and especially when you will be doing percussion, because at that point patient can get tenderness. So keep this thing in your mind. And yes, you will look for splenomegaly, and you will look for uh, shifting dullness as well, periaortic lymph nodes as well. I mean the complete steps, and even axillary and inguinal lymphadenopathy as well, because your case is GIT case. So inguinal lymph nodes, axillary lymph nodes are more important than cervical lymph nodes. And after that, yes, you will check about the pitting pedal edema, sacral edema. In case they are there, you should auscultate the basis of lungs as well. So that is basically all about your examination. In concerns, yes, you answered the concerns in a good manner, because whenever you are answering the concerns, you will start answering like that. I appreciate your concern, or your concern is quite valid, and then you will answer it in the shortest possible way and try to answer all of the concerns, because usually there are more than three concerns. So they will only be answered in case you give a good 2 minutes for the concerns. So whenever the examiners say that 2 minutes are left, in case if there is nothing important left, then you should come to the patient again and ask the concerns, because the concern management is very, very important. And these are, I think, free marks for the candidates, because if we total all the marks of concerns, you have only the chance to lose 5 marks, because 11 out of 16 is important to pass in case of concern management. And in case if you miss the concerns in one station, so you will only have the chance to lose 1 mark. So this is basically a very important skill, and most of the international graduates, they basically suffer because of this skill, which is actually quite easy to pass. Mostly the skill which these candidates suffer is the identifying physical sign and concern management. Physical sign you can only gather, for example, if you have a good practice, you have seen all of the patients, I mean the normal patients and the specific cases, and you are able to elicit the important physical signs. But this concern management is actually in your hand. If you manage your time properly, you can answer the concerns. Okay, so my voice is clear. I think Dr. Rahat mic is again muted. Anybody can write in the chat box. Okay, if the patient has pain in the right hypochondrium, we will examine this part in the end or not. Actually, yes, whenever you are palpating for abdomen, you make an S, and this right hypochondrium comes in the end. So yes, basically your main finding will lie here. This patient is saying to you that he has pain in the right hypochondrium in the history. For example, he may say that yes, I have heaviness in the right upper part of my tummy as well. In this way, you will be able to assess that okay, it might be a case of hepatomegaly. So you have to assess, just be gentle and do the examination by looking at the face of the patient, because these faces examiners will be at your I mean quite close to you whenever you are doing the examination. They will look at you, they will not remove your eyes from your face and the patient face, and they will keep on looking that how you are approaching this case. In case if you, for example, patient is quite tender, and you say this thing to the examiner that patient is tender, that's why I am not sure about the viscomegaly. However, I assume that this patient might have hepatomegaly. Even this thing will be liked by the examiner, but not that thing that you are just pushing your hand inside the right hypochondrium and causing pain, and you are just you just feel that I want to know that whether two finger are enlarged or three finger are enlarged. So just keep these things in mind, and yes, you will palpate this right hypochondrium in the end. And after that, yes, you will tell about the positive findings in your history to the examiner. Okay, one thing, Dr. Rahat here, that this patient is febrile and his fever is not going away anywhere, and you are not sure that whether it is a dual pathology. I mean, it might be a case that he has viral hepatitis as well, and he has drug-induced liver injury as well. I mean, super added. So you will admit this patient. In case if you are not sure, just give a diplomatic answer. For example, you can say, instead of telling yes or no, you can say that first of all, I will run for certain test of you. I will advise certain blood test as well as imaging test in the form of scan of your tummy, and then I will get back to you and I will be in a better position to answer this concern. Okay, so it might be a case that the examiners will mind this, that you are not admitting this patient. He is quite febrile. He has maybe the signs of dehydration, or for example, he has the evidence of nausea. You didn't ask about the appetite. Might be he has not eaten anything since last 1 week or something like that. So be careful while answering exactly. I mean, you are sure that you will not admit this patient. So you, instead of saying this, you can play safe. And regarding the positive findings in the history, even when you have written each and everything in your paper, I mean the positive findings, all the positive findings in the history, if you narrate by looking at the paper, the examiners will not mind. These basis examiners will not mind if you are narrating the history by not looking at the face of the examiner, by just reading from the paper. But they will just assess that, for example, you are telling each and every positive finding in the history that you asked from the patient, like in the form of family history, in the form of past history, okay, and tell the findings in the history in a sequenced manner. So your presentation matters a lot, not only in basis but in any um, clinical medicine exam, whether it is FCPS, MD, any exam. Presentation matters. And regarding the examination findings, when you are telling yes, you will tell the important negative findings as well. For example, you didn't find any stigmata of chronic liver disease. You will mention this thing in the end after telling your positive findings of examination. Or even, for example, you didn't find any lymphadenopathy or any other thing, important negatives should be told to the examiner. And regarding the investigations, yes, you will do complete blood count. What you want to look in that, you will tell this thing to the examiner as well. For example, you like to look the WBC's response here. I mean leukocytosis. You will tell this. Inflammatory markers in the form of ESR, C-reactive protein, they might be raised. And liver function test, on not only liver function test, what other things, or for example, what things you are interested in liver function test. Like for example, you are interested in looking at the levels of bilirubin and whether they are raised. Is it direct bilirubin raised, indirect bilirubin raised, and what you will expect that in case this is raised, I will look for this, or if this is raised, I will go to their diagnosis. Regarding the liver enzymes, in case ALT is raised, then it might be a case of viral hepatitis. AST is raised, it might be a case of alcoholic hepatitis or drug-induced liver injury, or even ischemic hepatitis. And regarding the other things, that is gamma GT and alkaline phosphatase, in case they are increased, they will show that there is some obstruction in the biliary channel. And yes, coagulation profile, PT, APTT, INR, they will show whether this patient has developed coagulopathy or acute liver failure symptoms or not. And viral serology, not only hepatitis A, but B, C, E as well. And okay, viral serology regarding cytomegalovirus, HIV, they are not a part of regular baseline investigations. And after that, yes, you will say about the ultrasound abdomen and pelvis in order to confirm your findings and RFTs and serum electrolyte as well. Even for example, in case if there is positive family history, because these basis examiners might give you a clue that his mother or his sister is suffering from autoimmune hepatitis. So in that case, you will include this autoimmune profile in the form of ANA, anti-mitochondrial antibody, anti-smooth muscle antibody, anti-LKM antibodies, just to rule out the other causes of autoimmune hepatitis, like autoimmune hepatitis or primary biliary cirrhosis, or like primary sclerosing cholangitis, and all these things. And serum ammonia levels, because you were interested in hepatic encephalopathy in the history, so you can confirm this in the investigations. And even serum albumin levels, which will show the synthetic function of the liver. And regarding the other conditions, although they are rare and not relevant here, but still, according to your case, for example, the examiner prompts you any other investigation, then you can say that I will go towards the iron profile in the case of serum ferritin or total iron binding capacity, just to rule out hemochromatosis or Wilson disease serum ceruloplasmin level, because you asked about the I think shakiness, involuntary shakiness of any part of the body. I think you were asking about the Wilson disease. And regarding the alpha 1 antitrypsin deficiency, and in case, for example, you are thinking about malignancy, so the tumor markers as well. And regarding the treatment, yes, you will answer like this: general treatment, specific treatment. General treatment will include patient education, counseling, and education of the disease, multidisciplinary team involvement. Even here, you will tell that what doctors or what staff will come under the MDT team: gastroenterologist, hepatologist, infectious disease specialist, because you are dealing with acute viral hepatitis, specialist nurses. So these all will come under multidisciplinary team. And supportive treatment, yes, you are right, but you will also say that, for example, avoid any hepatotoxic medications or any toxin exposure which can cause the liver injury, because this patient has taken paracetamol, and it might be a case that he has taken paracetamol at home as well, because he will consider that yes, I'm suffering from fever, so let's take this paracetamol. And this supportive treatment will be in the form of IV fluids here. Okay. And vitamin K, but that will only be given in case you hospitalize the patient, you admit the patient for that. And regarding, for example, any case of jaundice you are dealing with, you will give him advice regarding vaccination. You don't know that this patient is a case of hepatitis B. In case he has no hepatitis B, you will advise the hepatitis B vaccination here. And regarding the correction of electrolyte balance and the supportive treatment all. And in case, for example, if this is a case where the patient has increased INR, or the patient has evidence of coagulopathy in his history or on the examination, so you will advise the treatment according to that case. For example, fresh frozen plasma, it is also under your supportive treatment. And regarding in case if there is acute liver failure because of paracetamol injury, paracetamol levels and N-acetylcysteine according to that case. And in case if this patient is quite uh, toxic and going towards acute liver failure, you will inform the liver transplant team. However, this might be not be the case in exam, because they will keep a stable patient. Okay. And here you should know about all the hepatotoxic medicines. For example, this case might have come that this patient is a known case of tuberculosis, and now he has developed jaundice. So you know that either it is because of isoniazid, or it is because of the pyrazinamide. And there are certain other antibiotics as well, for example, nitrofurantoin and this coamoxiclave, other medicines as well, oral contraceptive pills, anabolic steroids. So keep these things also in your mind. So that is all about our case discussion. Any questions from anyone?
Thank you, ma'am, for giving me the opportunity.
You're welcome.
Ma'am, I have a question that if the patient is alcoholic, then in that jaundice case, I think we have to stop taking the alcohol.
Yes. I told this thing that
Okay.
here you will refrain the patient, even if it is in the recommended range, like the 14 pints per week is the recommended range for a male
Yes.
patient. But here, if he is alcoholic and he is taking this range or even less than that, still it will cause the further insult to the liver. So you will refrain him from using alcohol.
Okay, ma'am. Thank you.
Welcome. Any question from anyone, or you can write in the chat box, or you can raise your hand. Okay, so I think there is no question. Thank you so much, everyone, for joining this class.